Hello from the FreedomCare Initiative. Today we are going to discuss various questions related to the U.S. healthcare system for the audience of FreedomHouse Detroit. Our first question is, how is the U.S. medical system organized? The U.S. has roughly 26 doctors per 10,000 people and almost 1 million doctors in the country. Even so, accessing healthcare can be very challenging. The following are settings where healthcare is offered. Unfortunately, most of these settings require health insurance to get care. Primary care clinics are where both non-life-threatening acute problems and chronic medical conditions are managed. Non-life-threatening acute conditions can include urinary tract infections, flu-like symptoms, and an ankle sprain. Urgent care clinics provide medical care for non-life-threatening acute conditions, and that's with someone who is not your primary care provider. Some urgent care clinics are open at all times, 24 hours a day and 7 days a week. Emergency departments can be visited directly for life and limb-threatening, urgent or emergent medical issues. In the hospital, serious medical problems are addressed, requiring overnight stays. Specialized care clinics offer medical care related to a specific need or part of the body. So who provides medical care? In all the settings we discussed, there are medical professionals that can include doctors, allied health professionals, and registered nurses. The medical MDs are doctors of allopathic medicine, while DOs are doctors of osteopathic medicine. These abbreviations may sound confusing, but they represent different types of medical training that doctors can have. All doctors attend secondary school, university for an undergraduate degree, and medical school for 4 years. This education is followed by at least 3 years of residency training. To clarify, doctor and physician means the same thing. Common allied health professionals that you may encounter in various healthcare settings include nurse practitioners and physician assistants. These providers attend secondary school, university for 4 years, and at least 1.5 years of nursing or physician assistant school, followed by on-the-job training. Nurse practitioners and physician assistants are qualified to offer primary care as well as some specialized medical care. Registered nurses may be the main healthcare providers in certain settings, including schools and rural areas. They work in settings such as hospitals, clinics, and operating rooms. Medical assistants help with patient tasks, primarily in hospital or clinical settings. When should I see a doctor? You should see a doctor when there are urgent medical problems that you are experiencing, including a new injury, pain, or other troubling changes. Your primary care doctor is the doctor that manages your chronic medical problems as well as new medical complaints. You should ideally see this doctor at least yearly. Female patients should see a gynecologist, a physician who specializes in the female reproductive system, starting at age 13 to 15, and when attempting to have a baby. How do I get a primary care doctor? If you do not have healthcare insurance, you can call local doctors' offices who can explain what the out-of-pocket costs are. Specifically with Freedom House, there is a relationship with the following free clinics: Covenant Community Care, C Assist Clinic, which is open 1 day a week, and St. Francis Cabrini Clinic, which is also open 1 day a week. How do I get medications? Doctors can prescribe you specific medications based on the kinds of health problems that need to be treated. These prescriptions can be picked up from a pharmacy. Medications can be called to a pharmacy for you to pick up, or you can also bring a paper prescription to the pharmacy and wait until your medications are ready. You can get over-the-counter medications without a prescription from a doctor for pain relief, cold treatment, or other less serious concerns. What medical information is true online? There are many medical resources that you can access on the internet. However, these resources may not be accurate and can lead you to avoid seeking the appropriate medical care. There are a few resources online that are trusted, including the CDC, WHO, AAFP, ACOG, and the Merck Manual websites. Please do not seek medical care from the first result on Google or from blogs, because the information from those sites are not verified. In summary, for any medical emergency, contact Freedom House site staff who will help direct you to go to a hospital or to follow up as an outpatient. For non-life-threatening problems, consider going to a primary care doctor or urgent care facility. Thanks for listening. We will answer any of your questions during our next health education workshop.